Welcome to the Division of Aging online case management orientation. This is the level of care session on skilled medical needs. Let's begin. So in the eligibility screen document, section 1, or sometimes referred to as page 1, is where we identify severe medical conditions. The focus of this section is on the need for nursing facility level of care as determined by unstable, complex medical conditions. So the purpose of the items listed in this section is to establish if there are one or more medical conditions that require the intervention and management of a licensed nurse, which then would meet the eligibility criteria for nursing facility level of care. Here's a screenshot of the items that are included in section 1 or page 1 of the eligibility screen. So, clinically speaking, a medical condition that meets the criteria for one of these checks would be complex or unstable, and that would be characterized by the following situations. The condition must be fluctuating and or deteriorate rapidly. One or more treatments are administered from 3 times per week to more than once daily. Each item in section 1 or page 1 has specific frequency requirements. And you can refer to the help text that's available in InSight by right-clicking on any of these items to display what those frequency requirements are. And then the response or treatment that requires frequently monitoring or assessment by a licensed nursing personnel. In short, before we move on, the whole point of section 1 is to determine that if there are needs or interventions that would have to be performed by a licensed nurse in the absence of the individual's primary caregivers. Family members, parents of minor children, for example, frequently perform interventions and treatments that normally require a nurse, and they can do so as a family member. So this page 1 section of the e-screen is identifying those sorts of interventions that would require us to have a nursing level service or staff person there in the absence of the primary caregiver. That is really what triggers a skilled medical need when we're looking at nursing facility level of care. One term that we'll see used frequently throughout the eligibility screen, including on page 1 for skilled medical needs, is the term direct assistance. And direct assistance essentially means that the individual requires some hands-on assistance to complete a task or a treatment safely and or appropriately. The degree of their assistance is required, the degree of the assistance that is required is largely determined by the individual's cognitive and functional abilities. The definition of direct assistance for the eligibility screen is quite wide-ranging and begins with cueing assistance to someone who may physically be quite capable of performing a task, but because of perhaps something like dementia, would not know to perform that task, would not know the steps involved without extensive cueing assist by someone who is assisting them, whether it be a paid or unpaid assistance, all the way up to individuals who are completely unable to provide any assistance on their own and require total care, total assistance for whatever the activity is. So if you look at the levels of assistance identified in our direct assistance definition, you go all the way from that cueing involvement, which is referred to as supervision, all the way up to total dependence. And again, this definition is available in InSight in the e-screen by right-clicking on any number of items. These guidelines will come up to help you remember that direct assistance really encompasses a wide spectrum of support, all the way from very minimal oversight, encouragement, cueing kinds of assistance to total dependence. So let's start looking at some of the items on the page 1 of the e-screen, starting with decubitus ulcers or pressure sores. The requirement here is direct assistance for others is needed at least 5 days per week for treatment of extensive, referred to as stage 3 or stage 4 decubitus ulcers. Please note that describing the size and stage of the ulcers is part of the eligibility determination here. Again, in Insight, you can right-click and bring up this help text to help you understand exactly what pressure sores are and how they occur. Usually when a stage 3 or stage 4 ulcer is involved with an individual, they are often receiving assistance from a home health agency, and the nursing notes from there will provide you with the kind of documentation you need to justify the size and the stage of the ulcer as a requirement for this need. You can see here in the PowerPoint a description of the various stages. Keep in mind that once a pressure sore is classified as, say, a stage 4, it remains in that classification category all the way through the healing process. So at any given point, it may appear more like a stage 1 or stage 2, but if it began as a stage 4, it stays classified that way all the way through for purposes of eligibility determination. When we look at the item referring to medical equipment and interventions, again, the e-screen is very specific that it's looking for direct assistance from others required with any of the following prescribed medical equipment and interventions at least 3 days per week. And items like ventilator, respirator, suctioning, tube feeding, central venous or IV are listed here. This is kind of an incomplete list of the sorts of medical interventions that frequently occur in our homes. The eligibility screen is a tool that was developed many years ago, and it's not been updated for a long time. The division is working on that now. But in the meantime, you might run across medical interventions that are not listed here that do require skilled nursing assistance in the absence of the primary caregiver. If that happens, consult with your supervisor and the Division of Aging waiver unit on where the closest, most appropriate check mark is that you can make, and then you'll be able to make comments that describe exactly what the intervention is. Skipping down to acute rehabilitation therapies, this refers to direct assistance from others for special routines or prescribed treatments that must be followed at least 5 days per week. Acute rehabilitation conditions requiring physical therapy, occupational therapy, and/or speech therapy. This does exclude general strengthening exercise programs. This is an item that is marked quite frequently when pre-admission screening assessors are making determinations for nursing facility placement. But very often when this item is marked, it's reflective of a short-term nursing facility level of care approval. And that's in part because the word acute in itself implies a severe short-term situation. So for instance, if an individual has fallen and broken a hip, they may have a condition that is going to require some pretty extensive physical and occupational therapy, but it's going to be expected to be a short-term intervention. So we can't use that as a means to find long-term level of care for a waiver recipient. So you have to pay close attention to the words in this item, and that you're looking at that acute word implies that yes, it's severe, but it's also short-term in nature, which might not give them long-term nursing facility level of care. Another word to pay close attention to is rehabilitation. So this means that they are working on regaining skills that they had once and now have lost. This is not habilitation kinds of skills that you would encounter with individuals with intellectual disabilities who may have a great deal of therapy going on, but they're trying to learn skills that they never had. Unlike the person who has, for example, broken a hip, who knew how to walk, knew how to transfer, but they lost those skills because of the injury. and they're now in rehabilitative therapy to regain them again. So pay close attention to this in evaluating potential skilled needs of a waiver recipient. Now let's take a look at the item referred to as medical observation and physician assessment. Assessment due to a changing or unstable physical condition is required more often than every 30 days. Please note that simply having doctor's appointments once a month does not in itself warrant this check. The medical condition must be changing and unstable. And you can often identify that by asking questions about what the doctor is actually doing as a result of seeing the individual. In other words, are there medications or treatment changes that generally result from these physician appointments? That can be reflective of what is truly a changing and unstable physical condition. Very often, particularly with young children, they may have a number of specialists they're involved with, and they may see those doctors on a regular basis. And when you add it all up, it may equate to an appointment every 30 days. That does not imply the critical part of this requirement, which is a changing, unstable physical condition. So again, asking those questions about what happens as a result of those doctor's visits is very important. Finally, let's talk about seizures. The requirement here is for direct assistance from others being required for the safe management of an uncontrolled, what is referred to as a grand mal seizure disorder, i.e. that's at least weekly seizure activity. This is another area where the e-screen is a little bit out of date. Seizures aren't typically defined as grand mal anymore. They're kind of on a seizure spectrum, and they may have different names. But to warrant this check, you're really looking again for, is there some intervention that's required that would require a nurse in the absence of the primary caregiver? So you're looking for seizure activity that is recent, that requires some kind of an intervention, and that intervention requires a nurse in the absence of the primary caregiver. An individual may have seizures that requires no kind of intervention, that there's nothing anyone really has to do for them when the seizure occurs. And in that case, that's not a skilled medical need. You need that element where the intervention requires a nurse in the absence of the primary caregiver in order to document a skilled medical need. That completes our review of page 1 of the e-screen and some of the skilled medical needs that can be identified to find nursing facility level of care for an individual. We would recommend that you complete the short quiz that goes with this section to help you review the material contained here before you complete the test at the end of the online case management orientation. Thank you.